Okay, now you know, or you have a rough idea anyway, what's going to be on the show. It's something that concerns us all. It's a social responsibility that applies to our whole country.
It's drug addiction. And I'm going to reserve my comments until we've had more people on the show talking about drug addiction. What I want to say though, Amina, first up, is that I think we need to recognize, we need to blame the problem and not the person with the problem.
I have to tell you, we've had hammer and tongs offset on this one, yes. But she's right, it is a symptom. It's a symptom of our culture, it's a symptom of our society. Why does it happen? It happens with affluent people, it happens with poorer people as well. So what's the commonality in all of this? Let's find out.
Pakistan has been a major exporter of heroin since the 1980s, but drug abuse is a major issue in the country. According to statistics from 1993, there were just over 3 million drug users in Pakistan. More recent statistics put the number of drug users in Pakistan between 3 to 5 million. The statistics relating to drug use are outdated for the most part. Pakistan's drug laws call for a 5-year term in prison. However, the implementation of this law is still very weak.
We're going to talk today about drug addiction, or addiction in general, not necessarily drugs, but substance addiction, I think would be a better way of putting it.
We've got on our show today Dr. Sadaqat. He's an addictions psychiatrist. He works with an organization called WillingWays.
Come on the set, Dr. Sadaqat. Great to have you with us on the first blast. So what is addiction? Define addiction. What is it?
Basically, depending on something, some substance, person or activity, which is not dependable, but you start depending on it.
It's a disease?
Yeah.
It's not, generally, addiction is not considered a disease, but if you can shed some light on that.
You know, it is quite obvious that a lot of pain, hurt, anger and damages are coming out of this activity sometimes. And it is a matter of fact that all people who use drugs do not ultimately cross that line and become addicted to the drug, but there are about 10-15% people who ultimately cross that line and become addicted to a person, a substance or relationship or an activity which becomes disastrous for themselves and their family. So it is a genuine disease. And when it comes to substances or substance addiction, then definitely it is a physiological, biological disease. It starts in the biology of the person.
So you're saying that a lot of people turn towards this in a time of distress?
People don't turn to drugs in times of distress necessarily. They turn to drugs for recreation. It's mostly the happy times. It is the dinner time, it is the party time, it is the occasion which warrants somebody to use drugs and alcohol and other things. And it is not necessarily the hurt or pain or sadness or depression which leads ultimately to use of drugs. It is not a matter of will. It is something to do with the metabolic system of the body. It is the body of certain people which is vulnerable, and it is a defect of the body and not the defect of the mind. So the disease starts in the body, and it then leads to the psychology and sociology and spirituality.
So you're saying that your body is predisposed, some bodies are predisposed
some people have a predisposed, vulnerable bodies.
What is the first reaction that people have?
You see, the person suffering from addiction or alcoholism, first of all, he is going through denial. And then family gets this denial too, because it is too overwhelming to accept that a family member as an addict. So the family goes into denial. And as they say, the fish discovers water lost. So the person suffering from this addiction discovers last that he is suffering from a real problem.
The drugs that are sort of used
and abused.
Pakistan are abused.
And abused.
Basically, there are 4 kinds of drugs which are used all over the world. There are downers like alcohol and tranquilizers. There are uppers like caffeine, amphetamine and cocaine. Then there are narcotics. You are aware what narcotics are. And then there are mind benders like marijuana, PSP, and there are other mind benders.
LSD.
They used to be LSD.
So crack, LSD, ecstasy, where do they fall in all of this for the parents out there?
You should be talking to your children before the age of 7. Because you talk to your children about all important things before the age of 7. If you talk about drugs in true sense with your children at the age of about 4, 5, 6 or 7, then it is absorbed as such, like it is taken as religion. That if you tell them that
It's blind faith.
You put a software program at that time that drugs are not to be used, they are no. And that includes smoking also, the plain cigarette smoking, because that is a gateway to drugs. But at
I
the
hope
most,
you guys are listening. Gateway to drugs. That's the word Dr. Sadaqat used. Smoking is a gateway to drugs. Sorry, I'm
and
very
you
passionate
should
about
be
this.
talking to your children before the age of 13 at the most. I mean, after 13, it may be too late. They might be already using drugs. And a stitch in time saves 9.
As a young teenager, what are the chances that you're going to progress and carry on and that cigarette's going to become something else?
The drug use starts in teenage mostly. If you go through this teenage safely, the chances then decline of any initiation of drug use. At some time in life, people become curious about drugs. And there are
So are you
other
saying that-
occasions when
I mean,
doctors prescribe
which
drugs,
you
that
said
people
that it's
become
across
addicted
all
to.
strata, but people who travel and people who check into hotels are obviously a very sort of upper middle
High
class
risk-
or high class.
high risk group?
What about in are you saying that it's a problem of that class, or
No, it's problem of every class.
so what about the other class? I mean, how do
They get it from friends.
I think
They get the first introduction from friends. So it's free. For the first time, usually it is free. Nobody buys drugs on the very first occasion.
I think what happens is, this is what I understand, is when you change socioeconomic groups, the substance abuse might change.
Yeah.
But the addiction and the fact that there is substance abuse taking place, that doesn't change.
how do you go about getting them to come off an addiction?
Withdrawal management is basically a medical procedure and medical people do it. But the real thing is the motivation of the person. You have to build the motivation of the person to live without drug.
So it's the
And-
will. It's the will to push it through, the will to make it happen.
Yes, it's the will to make it happen, and it's also the methodology. You also teach him the kind of lifestyle which is alternative to using drugs, and that is like changing a religion.
Is it a problem with women as well?
I think it's different with men and women. There are a lot of men doing this kind of thing in the society than women are doing. And the treatment seeking behavior is also less in women because it is a stigma attached with that. So we get 100 patients as compared to one female patient, 100 male patients to
Really?
one female patient. But in
But
society,
in society
I
there
think
are more than
the
there's
ratio is
1%.
about 20-80.
Why are we struggling with this so badly? We seem to be, on the face of it. Why is that?
There are 5 million people who are addicted to drugs in Pakistan.
5 million.
Yeah, there are 5 million people.
How bad is the situation in the urban areas of Pakistan as compared to the rural areas of Pakistan? Is there any kind of pattern, or is it pretty much all flat across the board?
I think it's worse in urban areas of Pakistan,
Is that because
especially
of
in
the
Karachi,
congestion?
Lahore and
Population
Islamabad.
congestion? Is it just because
And-
we're all packed so close together?
And availability, maybe more available?
The availability and the price is quite easily
Really?
available, and the phenomenon of addiction is greater in that area.
Really? And it's accepted socially, is it, amongst the men over there?
Marijuana is mostly easily accepted. in the
Otherwise known
society.
as? Can we call it charas? Is it charas?
Yeah,
It's charas, isn't it? And
Yeah.
there's two or three varieties. You have oils.
there are
you have-
many.
There are many
There are
varieties.
about
of it.
100 varieties.
And-
Since 1960, stronger version of charas has come into market.
The more
and
concentrated
more
variety.
concentrated, more stronger than before.
All right.
And today's charas cannot be compared with charas of 50 years ago. It's about 100 times stronger than that, and it can cause psychosis.
Yeah.
In
Oh,
10%
interesting.
people, it causes psychosis.
I mean, what can the family do? What can parents do?
Once that's happened.
And what can perhaps schools or educational institutions do to deal with this problem?
Educational institutions can train their teachers who could communicate this message in class in a normal way, and not in a very, very alarming way. They can always give this message along with other educational messages. But when the tragedy has already happened and a
occurred.
family is already suffering from the addiction of a family member, they must first go through some counseling, and they should get some education about drug addiction and then talk to the person. They should not jump to the conclusions. They should not slap them, they should not nag them, they should not cover them.
Ostracize them.
Yeah, nothing like that. You just go to a doctor, you just go to a counselor, a psychologist.
What is the first reaction that people have?
You see, the person suffering from addiction or alcoholism, first of all, he is going through denial. And then family gets this denial too, because it is too overwhelming to accept
That
a
you have
family
problem,
member
yeah.
as an addict. So the family goes into denial. And as they say, the fish discovers water lost. So the person suffering from this addiction discovers last that he is suffering from a real problem.
But what does the individual actually experience physically and psychologically within themselves as they go through this withdrawal process?
It is what they do at their home. They try to quit, they try to reduce the amount of drug they have been using. And
But
what
can't.
happens is that they go through a lot of aches and pains and common cold symptoms. This is what we call as cold turkey. So they are suddenly amazed and surprised by this, and then they go back to using in the same manner. So repeated failures at home give them
Cut you short there. We'll have to go on a break. However, after the break, we'll be coming back and discussing more intervention and more treatment related aspects of alcoholism. Please don't go anywhere. We'll be right back.
I learned some things today. Even as a parent, I thought I knew it all about drugs, so I've done this with my kids, but this was an eye-opener. Thank you very much.
Thank you for having me.